If you have a choice between hospital and being at home, my choice is to be at home.
I'm able to socialise, I'm able to be active in the community.
It's about GPs working with all the existing services, but remembering that the patient is at the heart of this.
It's about trying to encourage people to do things for themselves.
It will mean that my time will be more appropriately spent doing what I've been trained to do.
This is innovative and it's the future for healthcare and social care within Leeds.
Health and care services for adults are changing in Leeds. GPs, health workers, social care staff and communities are working more closely together with people who use care and support to make services better and simpler for everyone. Staff from different organisations will work as a team to support the whole person, looking at where someone might be at risk of a condition becoming worse over time and working with them and their families to try and reduce that risk. People who have existing health conditions will get more support to manage their symptoms, keep their independence for as long as possible and improve their quality of life. We're making these changes so that fewer people have to go into hospital if they don't need to. More people can have their care and support provided at home, where that's right for them. Services can run more smoothly and be better coordinated. People won't keep having to give the same information to different staff over and over again. In this short film, people who use health and care services, along with GPs, health workers, social care staff and others, talk about how organisations are starting to think and work differently in Leeds. At the end of the film, there's information about how to get in touch or find out more.
Hopefully over the next few years, people who use our services will notice that there is a lot more partnership working, that the local authority and health organisation, as well as third sector and independent sector, are working closely together to deliver a more joined up service. But at the same time, that the individual is at the centre of everything that we do.
I've been working in healthcare for 22 years. People always talk about, we're at a crossroads or a fork in the road, or we're in a time of unprecedented change. I think we actually are now. If you talk to people who receive services, what they say overwhelmingly are a few simple things. Please come and look after me in my home or local community. If you do so, can you work in a team? Can you talk to each other? And can you be qualified?
We know that many older people and people with health conditions in the city are in touch with lots of services. It might be the hospital, it might be a district nurse, it might be social workers, or indeed the voluntary sector. We want people to know where they can best get the help they need. We want them to have a single point of access for either health or social care services. And we want our teams of workers to be working better together in a more coordinated way, bringing in support from the voluntary and community sector where necessary and where needed, and where people are able to be supported in their own communities. And if we can do that well, then we believe the people of Leeds will be better served by all of our services in the city.
In the context of mental health and learning disability services, it's our intention always to provide care programmes for people that fully reflect their health needs as well as their social care needs. And actually the integration process will enable us to do that in a much better way.
Underpinning our work in Leeds around joining up services, we're adopting a national model. The first element is about looking at the risk, so the risk to people in terms of their health needs. The second element is about how we join our services up, and the third element is about how we support people to take maximum control over their care.
Hospitals need to think differently in terms of they're only part of someone's care. I think we've got better in Leeds at doing that, so the ward that we're on today is very much about coming into hospital being assessed properly but speedily, and the reason to do it quickly is that we know the longer you're in hospital, the more difficult it is to get back home.
We were talking before about the reason why George had come into hospital,
Yes.
which was
Was it about his tablets?
Yes, it was. He'd been to the warfarin clinic and his INR was up dramatically.
Right.
And they suggested that he went to see his GP.
Okay.
He went to the doctor? He went to the doctor and he said, "You look very poorly and want to send you into hospital." From where I live, it's not, the journey's not bad. And when you get here, it's finding somewhere to park.
Yeah.
And then I'm sort of just in the house, then I'm out again to come back for the next lot of visiting. George likes to be at home, he doesn't like to be in hospital. And if we can care for him as we can, then that's fine.
The best services for older people are you come into hospital, you have your problems sorted out, and you get back home. We know that most older people spend their last months of life in hospital, and we spend more on that last year of life and need to focus much more on what are the alternatives to that and how can we keep people in their own homes if that's where they want to be. The real thing that we all need to do is put ourselves in the place of the patient. Big learning for me, it's taken me a whole lifetime of looking after older people to realise that.
One of the things we really need to solve is how we get the communication right between the community and the hospital. So if someone is being supported at home and helped to manage their own condition better, and then something goes wrong, perhaps late at night, so they end up in hospital, that team needs to be able to know straight away so they can immediately start the work to help get things right, to help that person get straight back out to the community. One of the things we really want to try to do is to make sure that we're looking at people as whole persons. Very often we've got someone who's got problems with their breathing and with their heart and with their arthritis and because they're lonely and they can't get out. And we need a team of people who will focus on the needs of that individual. And another way in which we're trying to work differently is by having some hospital specialists beginning to do some work outside of the hospital, so that if people are staying at home and not coming into hospital, but they would benefit from having a specialist assessment, that we can still offer them that specialist assessment without the need for a trip to hospital.
I've got different various illnesses, COPD and heart problems, diabetes. I have no problem going into hospital. It's just if you have a choice between hospital and being at home, my choice is to be at home. I can't sit in an easy chair like this at hospital. I've got equipment that they've put in for me. It takes temperature, blood sugar, blood pressure, pulse and oxygen levels. Keep your hand in, that's what I say.
In Leeds, we have quite a high diverse mortality rate between one end of the city compared to the other. It's about 13.5 years. It really is unacceptable. For a city of 800,000 population, we need to be trying to reduce that gap and understand, firstly we've got to understand why have we got that gap and how are we going to work at it. We need to look at the inequalities amongst our diverse population groups. We have a very mixed ethnic population as well in certain pockets of the city. So everybody's needs are different. We cannot say that one approach fits all. Teams are getting bigger, more diverse, and trying to cover many more angles. So it is more about GPs and accepting that we're not working alone. We are working with a team of people.
The multidisciplinary team will be able to provide more targeted care for our patients in Leeds. It will have an opportunity to meet together and discuss patients round the table. We'll be able to plan care and it will be an opportunity which is quite fundamental for patients, that they'll have the right health professional or social worker involved in the care at the right time.
I met David about 6 months ago, and at that time he was really very physically unwell with very complex health needs. He was frequently being admitted to hospital with these health needs about every fortnight usually. He was actually having to stay temporary accommodation with relatives because he was unable to live in his own flat because of his health needs. He had absolutely no input from social services at all at that time because he'd become unwell quite quickly in a relatively short space of time for quite a young person. We had to work very closely together in order to get his needs met. And as a result of that and a lot of work with David and his family and adult social care and health, he was eventually able to move back to his flat, live independently with a care package coming in 3 or 4 times a day.
Patients absolutely hate it when you've got lots of different services going in there asking the same questions over and over and over again. And the main benefit for patients now is the time constraints, because we've got rid of that now. Something that might have taken hours, days, weeks, months previously, we can now deal with direct. If it's something really important, we can have that face-to-face conversation with a social worker.
My role as a social worker within the integrated team is to work closely with district nurses and to advise them of what adult social care does and how we can help identify client needs together with district nurses and meet those needs as quickly as possible.
Self-management is very important. It means different things to different people. We need to understand, how do we get people to appreciate that it's not always that the doctor knows best? Actually, as a patient, you possibly know what you want.
I've got a progressive neurological condition, which means that my impairment has become worse over 20 years now, and it's only in recent years that I've actually needed the input from the services. The occupational therapist, the physiotherapist, the psychologists, the nurses, the doctors, they have been very much worked with me to try and help me self-manage and be self-sufficient. I want to remain independent, whereby I have people that care about me and care about my safety, for instance, but also allow me to take risks, because life without risk is like no life at all, as they say.
There's lots of different ways that the neighbourhood network schemes can help, and they have luncheon clubs, services that are appropriate to people's religion and ethnicity as well. Lots of people are set in their ways, and lots of people want you to come in and do things for them, and it's about trying to encourage people to do things for themselves.
Meanwood Elders Neighbourhood Action are one of 36 neighbourhood networks across Leeds. WRVS manages 3 and this is one of them. And basically what the neighbourhood networks are there to do is to find ways to keep people happy and settled and part of their community, and seek to find ways to meet any issues that people have that makes it more difficult for older people to stay within their community. An important part of what we do is keeping people out of hospital.
Every Thursday afternoon we come to the club and we do different things like exercise, bingo, games, meeting other people as well.
I think a lot of people of our age would tend to just stay in the house, watch television, if they didn't have a regular place to go to where they can do what we do.
That's not everybody can do everything. We just do what we can. You get the music on, you sing away. That's nice.